You're not bad at creating nursing care plans. You just need to read it the right way, and this is how. We shall start with its definition, which says that it is an organized, systematic, dynamic method of giving individualized care. Let's break it down. And we start with the words organized and systematic, which mean that this is going to be a step-by-step process. It's not by accident. We follow a specific order to ensure we don't miss any important information. And for the one dynamic, it means it is flexible, right? It is going to change as the patient situation changes. We say it is individualized, and that means it is not a one-size-fits-all approach, right? It is individualized. And the core of nursing process is identifying and treating how each individual is going to respond to health problems, both which are existing, that we shall call actual, and then the potential ones, which might happen in case we don't manage our patient very well. This could be anything from physical symptoms like pain or difficulty breathing to emotional responses like anxiety or depression. We are going to assess those responses, then we plan how to address them, take action, and then evaluate if our plan has worked. Exactly what I've talked about is the ADPI, all the components of the nursing process. ADPI stands for assessment, D for diagnosis, P for planning, I for implementation, and E for evaluation. And we are going to expand each of these ones so that you can understand exactly what they mean. So let's talk about assessment, which is going to be the very first step of the nursing process. It is about gathering all the information. We call that data collection, right? Now, the information we obtain in data collection is going to come in two types. First, we have subjective data, which is what your patient tells you. We often call these symptoms. It is their experience, their perspective. Think of things like, I have a headache, or my stomach hurts, or I'm feeling really tired. Only the patient can provide this information. It's all about their feelings and what they are experiencing. Then there is objective data. This is what you observe, or these are the signs, measurable, tangible information that we are going to gather using our senses, or maybe using objects. I think maybe that is why they call it objective data, because we shall use objects, thermometer, stethoscope, to gain information. Senses can also help us when we hear, we listen, we touch, we are able to understand or obtain this information. Maybe you see a rash, maybe you hear wheezing, or you feel a heartbeat. It's the information we gather directly through our senses, isn't it? So we can often record it numerically, like temperature reading, or maybe blood pressure. So to summarize, subjective data is what the patient says. Objective data is what you see, you hear, you feel, or smell. Now let's talk about the second component, which is the nursing diagnosis. And this is not just about what's wrong with the patient medically, because, with diagnosis, medically, that is what's wrong with the patient. But when you use the word nursing diagnosis, it is about how the body and the mind of the patient is responding to the condition. A nursing diagnosis is our professional opinion, it is our clinical judgment, or it is how a person is handling their condition. So the doctor might diagnose malaria, but we diagnose the patient's response to malaria. Things like fever, fatigue, or anorexia. Are you seeing the difference? And then we have two types of these nursing diagnoses. We have the actual and potential. Though you might be wondering, where shall we get our nursing diagnosis? We shall get them from NANDA. And you can check in the description where you'll get the link to download the simplified version of NANDA. Now, let's go and expand actual nursing diagnosis. These are going to be problems a patient currently has, right? And when we are formulating an actual nursing diagnosis, we are going to have a specific three-part format, which means that their problem or their diagnosis is acute pain, which we shall find where? From NANDA. Please check the description for it. Then we are going to relate it to the cause or to the pathophysiology, which is going to be head trauma. And then we shall support it with the evidence. It's going to be the patient's report. And precisely, that is how we formulate the actual diagnosis. And for the potential diagnoses, these haven't actually happened yet. They are not current problems, but we may see a high chance of them developing if we don't intervene. And they are usually having the two-part statement. For example, risk for inadequate fluid volume related to vomiting. We see vomiting, that is a risk factor, and therefore we worry about dehydration. We use these to prevent problems before they start. We go on to the planning phase, which is going to involve setting goals and outlining expected outcomes. These two might sound similar, but there are key differences. Now, for goals, they are big picture aims. They are what we want to achieve overall. And these goals can have different timelines, so we can classify them into 3 types. We have short-term goals, which are quick wins, and we shall achieve them within at least 5 days. Think of immediate pain relief. Think of stabilizing the patient's vital observations. Those are short-term goals. Then we have intermediate-term goals, which are medium-term, and these ones take a bit longer, around less than 30 days, maybe getting a patient to walk independently. Then we have long-term goals. So we aim to achieve these goals in more than 30 days. For example, complete wound healing. For expected outcomes, they are much more specific. These are going to describe precisely what we expect to see in the patient after our intervention. So it is going to be the evidence that shows that our goals are being met. For example, instead of just saying reduce patient's fevers, an expected outcome would be to reduce patient's temperature to between 36 degrees Celsius to 37.6 degrees Celsius within 30 minutes. That is what we call an expected outcome. So you see how specific and how measurable it is. Therefore, these detailed expected outcomes are going to help us track the progress, and then we adjust our plan if needed, right? Now, let's go to the next phase where we're going to be talking about the implementation phase. And this is where we put all our brilliant plans into motion, right? So the heart of implementation phase are the nursing interventions. And these are the specific things we do as nurses to help the patients reach their goals. So each intervention should be precise, it should be clear, and it should be directly linked to our goal or to our expected outcome. For example, if our goal is to reduce the patient's fever, the intervention might include administer antipyretic medication as prescribed or encourage adequate fluid intake. But it is not just about what we do. It is why you are doing it that matters. That is where the rationale is going to come in. The rationale is going to be the justification behind every intervention. It is going to explain the scientific reasoning, or it is going to give us the evidence-based practice behind your chosen actions. For example, you administer antipyretic medications as prescribed. Why? Because antipyretic medications help lower the fever. Or you are encouraging adequate fluid intake. Why? Because adequate fluid intake prevents dehydration. That is the rationale. And always remember, every intervention needs a rationale. This shows you understand why you're performing a specific action. And lastly, we go to the evaluation phase. So we are looking back at our plan, and most importantly, whether we have actually achieved our goals and expected outcomes. And this is not just a simple yes or no answer. It is going to involve looking at concrete evidence that is going to confirm that we have either achieved or we have not achieved our goals. And in case we achieve our goals, we are going to document our successes. How? Maybe patient verbalized that they no longer feel feverish after 30 minutes of receiving antibiotics. Or maybe thermometer reading was 36.7 degrees Celsius after 30 minutes. We have got our evidence. Wow! But what if we did not achieve our goals? What if we did not get our expected outcomes? That's okay. This isn't failure. It is going to be a valuable learning opportunity. So if the plan did work as expected, we need to reflect on what went wrong. So then we shall identify what needs improvement. We shall then brainstorm new interventions, and then we shall repeat the whole process. Now, to keep all this information we talked about organized, we shall use the nursing care plan. Now, for the nursing care plan, so to draw our nursing care plan, we need to have a scenario, or we need to have a medical condition. Maybe it is malaria, so we have the assessment already. Or we can have a scenario like what we are having in here. A 25-year-old female presents at OPD, and she's lying on her side, clutching her abdomen, and complains of nausea, and also appears anxious, and she's sweaty. We do our vital observations: heart rate 108 BPM, which is high, blood pressure 110/70, respiratory rate 22 breaths per minute, slightly high, and temperature 37.7 degrees Celsius, while SpO2 is just 97% on room air. Under our assessment, we are going to get subjective and objective data, which we have already covered, which means you know what it means. So from this assessment, then we are able to draw our nursing care plan. So our nursing care plan is going to be having 6 columns. So under these 6 columns, we shall have assessment, meaning the data we obtained. Then we formulate the nursing diagnosis. Then you do planning, where we shall talk about our goals and expected outcomes. Then after outlining our goals, we shall have the interventions, reason why you're doing something, and the rationale. Then lastly, the evaluation, which you have really explained very well, and it means you understand every single term that is on this nursing care plan. So we shall start with the assessment, where we saw that the patient was presenting with abdominal pain because she was clashing on abdomen, and also she reported herself that she was having abdominal pain. So to get the nursing diagnosis, we can refer to NANDA, and then we open it and we look for allowed nursing diagnoses under pain. And we have here, you can see we have acute pain. We also have chronic pain. Now, since the patient is just reporting it, we would have asked for how long, but we expect this is not more than 3 months. Therefore, that is going to be acute pain. Then we shall relate it to the cause or maybe the pathophysiology. Now, using NANDA, if you scroll down in the NANDA, you can find related factors. But for us here, we can use exactly what we are seeing. So here, we are going to relate it to the abdominal discomfort as evidenced by what? As evidenced by the patient clashing on her abdomen and also the verbal reports of pain, right? Then after getting our nursing diagnosis, we shall plan, or we get our expected outcomes, and that includes patient reporting a reduction in abdominal pain rated below 3 out of 10 on a pain scale within 2 hours. Then we shall continue with the implementation phase, where we shall give ourselves the interventions and each intervention with its rationale. For example, we are saying assess pain intensity, location, and quality regularly using a standardized pain scale. Why? Because pain assessment is going to aid in monitoring pain levels and guiding effective interventions. We provide a comfortable position, such as semi-Fowler's, to relieve abdominal discomfort. Why? Because semi-Fowler's position can relieve pressure on the abdomen and reduce discomfort. We administer prescribed analgesics. Why? Because they reduce pain. So every intervention must have a rationale. And later, in case you achieve your goals, that is when you do evaluation. Meaning our evaluation can sound like patient reports abdominal pain is reduced to 2 out of 10 within 30 minutes or within 1 hour, which means we shall have achieved our goal. To clearly understand, let's use another example. Expected outcomes, you can have more than one. And every time you have more than one outcome, it also means you are going to have more than one evaluation, because you need to evaluate every single expected outcome you gave us. Now let's have an example of a potential nursing diagnosis. So our patient complains of nausea, so which means that they are going to be at risk of vomiting. And when they vomit, it means they are going to lose amount of fluids in their bodies. So that means they are at risk for inadequate fluid volume related to nausea and decreased oral intake. So what are the expected outcomes? Our patient will maintain adequate hydration status, evidenced by stable vital observations. And then the patient will be able to tolerate fluids orally without nausea, which means our interventions will include monitoring intake and output, because when we monitor, we shall provide early detection of fluid imbalances, then we prevent complications. We shall encourage the patient to take sips of water every 30 minutes if tolerated. Why? Because frequent small sips can improve tolerance to fluids and support hydration. Or maybe we monitor vital signs every 2 hours to detect any signs of dehydration. Why? Because changes in vital signs can indicate fluid imbalance. Or we administer IV fluids as ordered if oral intake remains insufficient. Why? Because IV fluids are going to prevent dehydration. Then we can go back to our goals we wanted to achieve. Then we can evaluate them. Maybe the patient maintains adequate urine output and shows no signs of dehydration. Or maybe vital signs remain stable and the patient tolerates oral fluid. And remember, All the potential nursing diagnoses can also be called nursing concerns. And then finally, that is how a nursing care plan is going to look like, with the assessment column, nursing diagnosis, planning, interventions and their rationale, plus evaluation. So you might be asking, what about if it's a medical condition? It is exactly the same process that we shall follow. And then, to give you a quiz, create a nursing care plan for a patient with pneumonia. Submitting to this email that you see on the screen, you are going to get a response. Don't forget to subscribe, because that is how we grow.